Welcome to the Educate and Empower podcast, where we educate the community around healthcare and a healthy lifestyle. Welcome everyone to the Educate and Empower podcast. I'm your host, Rebecca East, nurse practitioner, CEO and founder of the Holistic Care Collective. Thank you all so much for joining us today. I am honoured to have what I would say a dear friend and colleague, Daniel Elwood, psychologist. Thanks, Dan, for being
Thanks for
here.
having me.
Let's start. Today's really about. We were going to talk very much around ADHD, but I think we'll just see how the conversation flows, like we always will. But the original topic that I had planned for us was ADHD. Is it just a trend, or is it something we've really missed in our previous management of mental health challenges? Firstly, before we get into that, can you tell the audience who you are and what you do?
I can do that. So Daniel, I'm a psychologist. I am, I guess, almost finished a clinical registrar program. So at the end of this year, I will gain what's called an area of practice endorsement as a clinical psychologist. And in terms of how that's different, 2 years of extra training and supervision, which is really useful for, I think, for psychologists who've just graduated. It's good to have that extra support and training. Um, I guess my journey to becoming a psychologist, I've always been interested in people and behavior. So I went to a seminar quite recently full of psychologists, and they asked that same question, why did you become a psychologist? And I'd say most people would put their hand up saying, just really interested in people. Like there's obviously, we get to help people, which is great, but I think that curiosity is really what starts sparks that interest. So I've always been interested in why people do the things they do. I'm a kind of person who I love to be able to explain things. I like to be able to see how things work, which often we can't, but it's good to have a go. So I'm Bendigo born and bred, and I held a variety of roles before I become a psychologist. So I've worked in the NDIS space as both a support worker and a support coordinator briefly, and I really credit those two roles because I got some really great exposure to psychosocial, I guess, disability and acute mental health going into my psychology training, which was great. I completed my clinical masters at Fed Uni, and my master's research was in ADHD and eating disorders. So my honours research was in men's body image and eating disorders. But as I discovered going into my master's, there was this really interesting link between ADHD and eating disorders. So that was my master's thesis. And I guess my practice now clinically is I work across private and public. So I hold a position in CAMS in Bendigo Health, and also in that job I'm in the autism assessment team and the 0 to 11 team. So I have a pretty keen interest in I guess infants and kids and parents. And in private practice, I practice across the lifespan. I find myself drawn to assessment quite a bit. I do enjoy working with people therapeutically, but I do enjoy assessment, and in that cognitive assessment, educational assessment, ADHD, autism, and as you probably have realised, there's been quite a surge in people presenting, I guess, looking for that question to be answered of ADHD or autism or both. But ironically, I often actually see it's not necessarily people coming to see me. I actually see it in reverse. They come to see you for something else, and I'm sitting there going, "Oh, I think there's some possible neurodiversity here or neurodivergence here." So, yeah,
Yeah,
that's kind of.
that's amazing. I never even thought of it like that.
Mm,
So that's really
yeah.
important. Can you explain to the listeners that may not be so, I guess, educated in ADHD, autism? What are they?
Yep.
What can you
Yeah.
explain?
So,
Yeah.
from I guess, diagnostic perspective, so when I'm talking here, I'm going to be sort of referencing DSM-5 diagnostic criteria. So that's I guess, the big book of mental health diagnoses in which usually psychologists and psychiatrists will use
Mhm.
that resource to make a diagnosis, but other professionals do as well. Um, and
Mhm.
so in the DSM-5, ADHD, or attention deficit hyperactivity disorder, which is a terrible name for what it actually is,
Mm.
I'll address
Mm.
that. ADHD
Mm.
and autism are what are referred to as neurodevelopmental disorders, meaning that they are disorders of development, and are usually seen or present in the developmental period. Um, and historically, ADHD in particular was for a long time seen as a developmental condition or a children's condition in which you would grow out of, or kind of there was no real sort of acknowledgement that an adult could have ADHD still. So that's an interesting
Mm.
progression, how that's changed.
Yeah, and I guess, and thanks for that, because as I said, a lot of people just know ADHD, and as we were talking offline before, it's sometimes just associated with that
Mm,
bad behaviour. But it's obviously we both know that that's significantly greater than that. What is it? Why is the trend? There's obviously I've certainly noticed it in my own practice in terms of a lot of adult
mm,
diagnoses. As you say, I remember even in my career pathway, certainly adult ADHD and autism was never really, unless they were being diagnosed
mm,
as a child, they'd never been diagnosed
yep.
later in life. What is it? Just a trend, or what's shaped this change in our I guess
Yeah.
practice? Yeah, I suppose it's practice.
Um,
Mm.
I think that the very similar to, so lots of people ask the question, and I'm not, so that's not hyperbole. People have legitimately asked me, or people had said, like, why are we seeing more autism or ADHD? And I think probably
Yeah.
the explanation that probably fits the best is that the diagnostic criteria has expanded and changed. And the reason
Okay.
that that has happened is our understanding of these I guess, conditions. And I'm giving a heads up that I do try and practice in what's called the neurodiversity affirming paradigm, in which we sort of are moving away from seeing things like ADHD and autism as disorders or abnormal and kind of just a different brain style or brain type. But I guess I'll
Mm.
use the word condition. I mean that in just a way of explaining it. Um, I think that as our understanding of these things have changed and improved, that what we're probably seeing is people, like you were saying before, that 20 or 30 years ago, um, myself included, I have got ADHD, who were missed because their presentation or the way that their ADHD or autism manifested wasn't consistent with what the diagnostic criteria at the time said. This is what this thing is.
Mm.
That's particularly
Yep.
pertinent, I think, for autism. And I
Yep.
guess it's the other thing that we know is that historically a lot of the research and the clinical practice was very male focused. So women and girls were really missed in that. And you've
Yep.
probably heard before people say it's harder to diagnose autism or ADHD in women, or and things like that, which I think is probably a reflection of that. It can look different. I don't think it's necessarily harder, uh, but it can look different for various reasons. So I think that what we're seeing now is we've got a resurgence of later in life diagnoses that are people that were
Mm.
missed, or as you said, were naughty, or there's behavioural things that possibly were better explained by ADHD.
Yeah, it's such a interesting, and as I said, even that male versus female and the assessment tool must be even challenging. And I'm sure, as I said, actually each person presents to you
Mm.
differently, so you have to assess them as they are, not with who they are, or what sex they
Yeah,
are, or anything like that.
yeah,
What yeah, it's really interesting. Let's talk about some
mm.
misconceptions, because there are a
Yeah,
bucket load. I actually would say shitload, and I'm allowed to
yeah,
swear
that's
on
fair.
my own podcast. But there is a shitload around these
Yeah.
misconceptions. What are some of the ones that either irk you, would love if you could, as I said, if you've got the opportunity to
Sure.
educate people within the community from this podcast? What would
Mm.
you say
That,
to them about the misconceptions? And we've
I
got all
was just going
afternoon.
to say, glad you asked. I've got ADHD, I can talk. Uh, So I guess the biggest one that comes to mind for ADHD is the actual
Mm.
name of what's happening is probably not an accurate description of the internal experience. So certainly what I will talk about is I think ADHD and autism compared to other mental health stuff, there's a
Yep.
lot of the way we interact with and diagnose and assess people is observational. And whilst
Mm.
that's important, observational information is important, it's also good to talk to a person about their experience. And so I think what is often missed is, particularly with ADHD, you see on the outside this collection of things, but you don't know what's going on internally. So I guess the biggest example would be most people have seen a little boy with ADHD and have gone, wow, he's got ADHD because he can't sit still. He's running around. He's a motor mouth. He's very verbally impulsive. He's doing risky things. He's jumping off things, all those very clear, observable things. And you go, okay, I can see the ADHD. Inattention is not always visible. There are some ways that it
Mm.
does present from an observational standpoint, but it's largely an internal experience. And so this is why historically women were missed, because there's this idea that um, you can't see inattention as well as you can. So think about it from a
Mm.
classroom perspective. The squeaky wheel gets the oil.
Mm.
If you've got a kid who's
Yes.
chuck it, really physical, he won't sit down, he's interrupting others. It's very clear, and he or she takes up that teacher's attention and time, and so it's very clearly obvious. But if you've got a little girl or a little boy, but it's usually, I guess, girls, in the
Mm.
background, quiet, they're not drawing any attention, but they're out the window like this, daydreaming. They're not getting
Mm.
noticed because they're not making a scene. They're not making a fuss. They're not taking someone's attention. So I guess
Yeah.
that's the biggest misconception, is that that it's always visible. The second one is that, yeah, again, going back to the name, attention deficit. It's not a deficit of attention. It's not that there's not enough. It's actually the opposite. It's too much attention and not being able to direct your attention to what you want to be able to direct it to. So
Yep.
the name is not great because it suggests that people can't pay attention. If you talk to anyone, particularly
Mm.
adults with ADHD, and you ask them about, we call it hyperfocus, they can pay attention,
Yep.
sometimes to the point that they lose track of time. They've lost 4 or 5 hours of their afternoon because they've been so engrossed in something. So, like, it's not about not being able to pay attention. It's that what happens
Mm.
is that your ability to direct your attention to something that you need is hard or sometimes impossible to do. So
Yeah.
as a psychologist, and I'm sure you're probably the same, we've got administrative and notes and things like that, like administrative responsibilities and notes we have to attend to. But that's boring. Like but it is. But there are things we have
Yeah.
to do. And for someone with
It is.
for someone
Yeah.
without ADHD, they can probably acknowledge it's boring, but I can sustain my attention enough to get it done and move on. And your brain gives you enough of that dopamine and enough reward chemical to get that task done. Whereas ADHD, it's like, yeah, that's later. Or in their head, they might tell
Yeah.
themselves, yeah, I'll do that later, and it never gets done. Or they go, the simple act of actually saying, I'll do it later, feels like they've ticked the box. So, um, yeah, I'll try not to use too much of my own experience because I think that it's important
No,
to,
no.
that it does look different with everyone. But I was diagnosed towards the end of my clinical masters. And when I went for the assessment, I spoke to people, some colleagues and friends at the time. I said, "Do you reckon I've got ADHD?" Like, it was my area of risk. Like, I knew the condition well, but I kind of was like, "Oh, maybe because I'm so interested in it and so involved in it, maybe I'm seeing it." And I had one
Yep.
person sort of say, "Oh, I can understand what you're saying, but look what you're doing. You're working almost full time, doing a master's, all these things. You would expect to be, finding it hard to do all these things."
Mm.
Um, and
Mm.
there's a phrase we use kind of with both sort of autism and ADHD, and it is when demand exceeds capacity. And so for me,
Yeah.
my capacity was exceeded with the demands I had at the time. So that's when it was very clearly obvious that I had ADHD, and I had a really lovely psychiatrist who acknowledged very similarly that she goes, "I can see you're quite a high functioning
Mm.
person." She goes, "But it must be really hard for you day to day." And I've never felt so seen, because I would look at people do their notes and just go, "How do you do that?" Like, I'm sitting there going, like the
Yeah, yeah,
idea of sitting there and completing those notes feels like a physical discomfort, is how I would describe it. So
yeah.
I think that's important
Mm,
to acknowledge that the name probably does it a disservice because it's your ability to
yeah.
direct your mental resources, not that you haven't got them. Yeah.
Yeah, absolutely. Yeah, that's super interesting, and I think that people will that'll be a real take home for people listening to this. That's awesome. Thank you so much. I guess I'm sitting here going, okay, so if I was a mom of a 7-year-old
Mm,
boy, and I was having those kind of challenges, and I wasn't sure, and someone had suggested, a school teacher, let's just say, that suggested that perhaps there was some behavioural issues that are far greater than, as you say, sitting still and not listening. Um, what's the first step? What is your advice as someone who,
mm,
as a professional, who where would they start? Where would a would what how would you trust
mm,
your instincts? I don't know. Like as a mum, I would go, okay, let's
mm.
put this logically and sift it out. But if there's that lingering, uncertainty, then you would seek,
Mm.
what's their advice for a
Yep.
mother or a father or a carer, that would have someone young? And I'm going to come back to you and
Yeah.
ask you about
Yeah.
someone who's adult and is in
Yeah.
question
All right.
too.
This is a tough one in the sense that so that I guess there's what you can do, and then there's the resources we have in the community at the moment to meet it.
Mm,
So if you've got a
yeah.
young person who let's say that a teacher has flagged that possibly that's occurring.
Mm,
Depending on where you are, your first step for that I would probably recommend is accessing a pediatrician if you can. The reason I say that,
yeah.
so psychologists,
Mhm.
psychiatrists, and pediatricians are probably the three health professionals most appropriately qualified to assess and diagnose that condition. But the reality is the evidence
Okay.
base doesn't really support sort of psychological therapy as a treatment for ADHD. I'll make clear, I'm not saying that that's
Mm,
not helpful, but what it doesn't treat is the actual
no, no.
executive function issues. Often the psychological treatments for
Yeah.
those are for kind of what I describe as picking up the pieces that have broken as a result of having ADHD. Um,
Yeah.
so
Yep.
stimulant
It's a
medication
lovely.
is currently widely accepted as the frontline treatment for
Mm-hmm.
ADHD, and a psychiatrist and
Mm-hmm.
pediatrician in Australia are the only two medical professionals that can create an initial prescription of a stimulant medication. So
Yeah.
whilst either a psychologist or a pediatrician can assess and diagnose, most people, to cut out that middleman, because if you see a psychologist and we make a diagnosis, and the parent might go, what's next? And we go, well, you'll need to go and see a pediatrician or a child and
Yeah.
adolescent psychiatrist. And it kind of is double handling to a degree because it's expensive. So
Yeah.
I
Mm.
will often, when I get interest from a private perspective, it's very different in the public system. From a private
Yeah.
perspective, I'll have a conversation with a parent and say, look, happy to do it, but here's what you'll likely need to go and do. And as long as you're happy to know that there'll probably be, you know, additional costs and things involved, the best part is to see your GP and get a referral to see a pediatrician for that age range, I'd
Mhm.
recommend. But that, again, as you would know, particularly in regional and rural areas, there's wait times of up to
Mm.
12 months plus. I know that it's really hard to see a ped. So, in the interim, you could see a psychologist. Or look, there are
Yeah.
other professionals out there like ADHD coaches and things like that, and they're actually quite good in terms
Mm-hmm.
of their strategies and things. But really, if you can
Mm.
see a specialist, it's probably the best step to
Yep.
take.
Yeah, that's such wonderful advice. Because as I said, I know, but I genuinely can guarantee you that there's women and men that walk in my door, and quite often, as I said, I don't just talk about
Mm,
what they're presenting for. We need to
mm,
understand their social impacts, and a lot of the time they'll ask me, oh, at the end of the consult, oh, by the way, do you know? And
yeah,
yeah, it's a really challenging area. And as I said before we recorded, I said you and I could talk about the industry
yeah,
till the cows come home, but
mm,
it's for another day maybe. Access is really challenging, but it's a really good point in terms of, because quite often these I'll just use me myself as a mum. I would go to the GP, and then I would go. Yes, they would. You know, you want to be on the forefront to say then to go. Okay, well, I need this, rather than them directing you, as you say, to the psychologist. That, as you say, yes, you're helpful and beneficial, but you're not the first point of call in terms of you need that stimulating medication and you need the pediatrician, because also I'm sure you would support, sometimes it's better to the pediatrician to
Correct.
make sure that there's
Yes,
nothing else
100%. I
going
was going to
on with the
say,
child
yeah,
as well. And then, yeah, it's not just pinpointed to, you've got ADHD, autism,
yeah.
bad behavior. There could be something else causing
Yeah, and I was going to
some of
say
these
that
things.
really I guess that in the crossover of psychology and medicine, the way we're trained is actually not to look for
Mm,
things, but to exclude everything else, do a differential diagnosis. So, and there is limits to what a
yeah.
psychologist can do, and that's where having a pediatrician or a child and adolescent psychiatrist is really useful because they can actually screen for more organic or biological reasons. The other part that's really important is that stimulant medication is very, like in most cases, very effective and very safe, but it does require medical
Mm,
monitoring. And so it's really important that you
yeah.
can, and again, I say this knowing it's really hard to do so, but find a pediatrician who you can see
Mm,
semi-regularly and have bloods and, ECG and all those things done to make sure that the dose you're on is, ideal and you're not, there's no ongoing kind of health issues as well. So it's really important to for that reason as well. Is that the pediatrician? We're talking about children. The
mm,
pediatrician can
yes.
you know make sure that it's more comprehensive and holistic. Very often, a pediatrician will see someone, and this happens, I guess, semi frequently. Is they'll go, "Oh, I think it's ADHD. I've done a screening tool, something not sure," and I'll get a referral saying, "Can you please explore this further?" Because typically
Mm,
psychologists tend to assess more than those other two professions. When I say more, I don't mean
yep.
that it's necessarily better, but we usually use very specific tools and probably go a little bit more in depth on average.
Yeah.
So off,
Yep. You focus
yes,
on the devil in the
yeah,
detail
yeah,
almost,
yeah.
rather
Which is
than,
not
yeah,
not necessarily
which
one
is
better than the
as
other,
a
but often when there's questions and the peds sort of and the other thing is a pediatrician can usually only see someone once and then it'll be 12 months before they see them again, whereas a psychologist can do sort of more uh, frequent sessions usually. So it's we've got more capacity to do that testing anyway. So yeah.
yeah. No,
Mm,
that's
mm,
really, really beneficial, honestly.
yeah.
Let's talk about the adults now. If there's someone sitting in the car or they're sitting in their lounge room listening to this and they're like, wow, I really do
Mm,
think I need to see, because, in my gut instinct,
yep.
intuition, you know,
Mm.
family history, whatever it is, like, how do they access services, and or how do they seek diagnoses or support, in
Yeah,
the adult
the adult space
space?
has been interesting because I think I read somewhere that
Mm,
that there's kind of this social media like TikTok and things like that have really kind of exploded with ADHD stuff. I guess plot
mm,
twist. It's not always credible. Some of it is reasonable. I don't have anything that I can say. Oh, this one's credible. I've seen some stuff and gone, oh, yeah, okay, that's credible. And
mm,
but most of the time, it's not. Like I think I saw someone who goes, oh, do you get tired all the time? You've probably got ADHD, and it's like, yeah, I don't think that's like so. You see some really kind of just people making some pretty big leaps, but one of the things that actually had from a
yeah.
positive is that for some people, those little gems of TikTok which are right, it actually makes people go, oh, I didn't know that was it. So from my perspective,
Mm,
I'm sure that I've got colleagues who wouldn't agree because they're getting absolutely slammed with ADHD assessment referrals. What social media has done is actually there has been a semi psychoeducational component in which some people who did go
mm,
on to reach criteria, it's been eye opening for them. So you will hear people have mixed opinions about that, kind of going that, oh well, because that the TikTok's sort of rampant with all this stuff that everyone thinks they've got it. Um, my personal, I guess, opinion in that is, well, we can't control how someone comes to us or why they've referred. It's our job to answer the question for them, and if it's no, it's no. Um, that kind of
that's
how
right.
they come to that. Like, it's not treated as like if I see something on TV and think I might have diabetes, no one kind of goes, oh well, you've just watched social media. Like it's a bit different. So it's a bit bizarre to me that people kind of push back. So
Yes.
um, again, we see a lot of that with adults.
Interesting.
However, the process can be slightly different. Some adults are not interested in medication,
Mm.
and that's fine. It's a choice.
Yep.
So some adults will come to me or come to see a psychologist or even a psychiatrist for what I've sort of called self-discovery. Like they kind of want to know, a lot of the times,
Mm.
um, adults with undiagnosed ADHD have very poor self-image and have had a history of challenges in maintaining employment or relationship issues and things that ADHD has played an underlying role in making those challenging. And often they just want to know,
Mm.
is there something that explains this for me, or am I, because people come in going, oh, am I just shit or lazy or all these different things? So often, if that's kind of what you're wanting, is kind of someone to say, yes, ADHD, you do meet criteria and kind of some strategies and some education around that, then you could see a psychologist who has experience in an assessment of ADHD. But if you are thinking that you would like to trial stimulants, then the same holds true for an adult. As a child, you will need to see a psychiatrist. Um, and I
Yep.
would say from experience, it's probably easier to see a psychiatrist privately at the moment than it is a pediatrician. I haven't checked, but there seems to be shorter wait times. There's a lot of
Yeah.
psychiatrists in Melbourne that are doing telehealth ADHD assessment. People kind of get a bit funny
Yep.
about that. I'm not going to get bogged down on that.
Mm.
My 2 cents in that is some telehealth assessment is better than waiting or no access to no assessment. So I think preferentially most
Yep.
people would like to do that face to face, but telehealth opens up
Mm.
capacity for people to be seen. So it's a bit of a balancing act. Like a lot of people go, I don't want it to be done telehealth. That's fine, but it is easier to see in Victoria. Yeah, I know there are some psychiatrists who are doing telehealth assessment. So again, you would need to see your GP. The first point of call, as you would know, to see a specialist in
Yep.
Australia, you need to see your GP for a referral.
Mm.
So
Yep. Yeah. And that's really, really great. As I said, so many golden little nuggets there. Let's talk about the, I guess, the resources that people can tap into that perhaps while they wait, or some great websites that you've got, or for a mum who's scrolling in the middle of the night worried about her son or daughter, or the woman who's had weight loss surgery who is
mm,
pretty confident that she's now actually all of her past experiences gone through weight loss surgery, and then some things just don't quite add up. Where can they start? Is there some ways that they can, that you would say, well,
yeah,
these are some great websites or some tools? As you said, social media can
mm,
be really, really awful, and then there can be some really, as you say, some terrific content and resources from there. It's really hard to filter that.
yeah. So in
But
terms of
yeah.
what can they do in when they're waiting? So there are lots of free. So that one of the screening tools. So I'll explain when I say screening tool. So a screening tool is
Mm.
a checklist or something like that. So they're a self-report, meaning someone fills them out. It's not a clinician or someone who's kind of doing that. They're free to access. There's one called the ASRS, and it is actually a really sensational one. It's got what we call very good psychometrics, meaning that it's a valid and reliable um, tool to screen for ADHD. So when I'm saying screening, we're saying it's very sensitive to picking up ADHD, but
Yeah.
it's not specific enough to be able to make it. So there's no such thing as a
No.
diagnostic tool. So that the clinician is the diagnostic tool.
Yep.
We use different tools to
Yes.
aid us in
Yep.
getting that information. Sometimes screen is a part of it. So that would be probably a good start.
Yep.
So the ASRS, the adult
Mm.
self-report,
Yep.
um, you could have a look at that
Mm-hmm.
and just, if you're answering it honestly, have a look at that. And that actually, by doing that, you can then take that into your health professional anyway. I wouldn't even necessarily complete it.
Mm.
Just have a look at some of the questions rather than ticking the box or filling it out. Just reading it, going, oh, is that me or is that not me? And if it is me, how often is it happening? Because
Mm.
the important thing with ADHD is what we're
Yep.
trying to establish is a lot of ADHD behaviors in isolation aren't pathological. Like lots of people forget things. Like we all forget things every now and then. But if you
Mm.
frequently leave your phone, keys, wallet, sunglasses, and you frequently have to like turn the car around and be like, oh, I've left my thing for work. Lots That's different than having it happen occasionally. So, everyone, some people
Yeah.
might forget to put the bins out, or they might get distracted, or some people might cut someone off in a conversation every now and then. But if these things are happening frequently, and there's this collection of things happening frequently, and we're saying, okay, well, that's important, because one of the things I hear a lot is people go, oh, yeah, but everyone has that. That's normal. Well, we're not saying it's not normal. We're saying that
Mm.
these behaviors are happening enough that it's having an impact. Very rarely do people come
Yes.
to see me or perhaps or even see yourself and go, "Oh, I'm here because I forgot something the other day. It's the only time I forgot something." Like it's not. They're usually coming because they're like, "Well, I forgot to pay my gas bill, and now I'm in arrears." And you might ask, "Oh, is that the only bill that's happened to?" No, I've got lots of them. I'm in financial, which is a really big one for adults, and it's one of the
Yeah.
flags I look for when I'm seeing people is things like that, where they come to me with some sort of financial issue. I go, "Ooh."
Yeah.
I look for underlying, and because, if it's impulsivity, is there gambling, is there impulse buying, all these different things that, um, but again, those things just happen, but are they happening in addition to all the
Yeah.
other things happening? So checklists like that are good because
Yeah.
you can just read them and say, well, yeah, that happens, but not often, or yeah, that happens a lot. The other one resource I
Mm.
tell people is there's a person called Russell Barkley. He's a
Hmm.
probably one of the more prolific ADHD researchers. He's a psychologist in the States. He's published
Okay.
lots, but he's also got really, really great books for the general public. Um, and one of them that I recommend to everyone's called When a Person You Love Has ADHD. And it is a
Mm.
phenomenal
Love
book.
it.
And even if you're wondering about it, that would probably be a good read. I say that because the evidence base we have, a lot of it is because of him. So that's a really good resource. Anything by
Mm.
Russell Barkley, anything that's, you know, ADHD Australia and things like that that are credible. Um, even practitioners like myself in isolation, I think we need to be skeptical. I think when we've got sort of, organizations or kind of larger groups giving advice, that's usually a sign of some credibility. But just be wary of people who are like looking for cures, selling cures, or telling you that the reason your child has ADHD is because they have too much food coloring or having too much sugar and things like that. Um, so those haven't panned out in the
Yeah.
research. Initially in the 80s, that was huge. Like there was a big question, and we now know that the link between those two is quite weak. So we don't sort of say that's why. Yeah, or selling you cures outside of
Yeah. That's amazing.
medication. Um,
Yeah.
that's something to be. I guess if you're thinking about, you said what to look for,
Yeah.
probably what to avoid is important as well. Yeah,
Mm.
yeah,
Yeah. Absolutely. 100%. On that, you and I value health and well-being. We
yes,
think exercise should be a good nutrition. I know you're very important to that. Are those things helpful in these elements? Like I know we
mm,
just touched on no food colorings and all that rubbish, but are there
yeah,
any alternative things that people can implement? I know people working, whether it's right or wrong. People have found that chiropractic work in terms
mm,
of nervous system work, not crunching and banging for young children, can really benefit. And is there anything, as I said, good
mm,
nutrition you'll never go
mm,
wrong with, and good exercise? Is there any other kind of tips and tricks that you could, as I said, you could implement without even, I mean, it's not going to hurt the child, it's actually going to enhance them no matter whether
yeah,
they're
yep,
busy or they've got
yeah.
ADHD. Do you get what I mean? Are there things that we can implement as uh, patients, or parents of or carers, that would benefit children
Yeah, I think
or
everything you just
adults
said
in
is
this
really
space?
important and clearly, I when I first started in my career, I had before I was registered, I did some counselling, and my supervisor at the time was a very senior and experienced clinical psychologist, and she, when I was, took me under her wing, and she talked about the first thing you need to address with people is what she called the pillars or the foundations of mental health, and those were diet and exercise and sleep. So all those lifestyle factors are hugely important
Yes.
just across the board. But interestingly, for ADHD, there is actually
Mm.
research that aerobic exercise actually can improve people's perception and improve their I guess, perceived level of ADHD symptoms. So my psychiatrist actually put that in my report, and there is literature. People have said that
Yes.
specifically aerobic exercise. Off the top of my head, I think it's sort of it was kind of in
Okay.
line with what we would say anyway. So 30 minutes of moderate effort, kind of if you can daily. But again, we've got our guidelines. I just say to people, do anything you can. Like just because you're not hitting the guidelines doesn't mean it's not
Yeah.
helpful. So aerobic exercise, and you'll notice that,
Okay.
or you might not, but that kids with ADHD, when they do lots of exercise, they actually they can regulate a lot better. That's part of that is actually wearing themselves out and
Yeah.
kind of, um, and one of the diagnostic tools we use called the Diva, it's a semi-structured interview. We actually ask parents, even parents of adult people coming in, saying, kind of did they have to kind of wear them? Did you notice they kind of wore themselves out or got injuries from being so active? Because it's the only way they could relax or feel relaxed. So yes,
Yes.
certainly aerobic
Yeah.
exercise. I feel pretty confident in saying, and that's a good recommendation in general.
Mm.
Um, yeah,
And that's what I kind of figure. You can't go wrong by even starting with, if you are concerned about your mental health or the,
mm,
neurodivergence of your child, then start with the basics while you wait. It's yes, start looking at those moments. But anyone can optimize your own health. Anyone can, change, and I'm not saying that they go gluten-free, dairy-free, because if I hear that, young child, I'll
mm,
scream, unless they obviously have a diagnosis. But um, I think by really looking at
yep,
listening to your
yep,
intuition as a parent and a carer, and following the really simple basic guidelines of good nutrition, as you say,
yep,
great health, sleep health, winding them
mm,
down for bed,
yep,
reading, all of those things, and good exercise, and aerobic sounds like the perfect. But as you
yep,
say, anything that a child does
100%.
will benefit, and an adult will benefit their health. And that we were talking about that on a podcast I did earlier this week about if we don't exercise for weight loss. We actually need to weight loss. We need to
Yep, yep,
exercise to live
yep.
longer. Like
No,
it's not hard. It doesn't have to be rocket science. In
no,
fact, it's not going to help you lose weight much anyway. So, um, yeah, it's really interesting. This has been really, really enlightening. Truly, I've loved it. Thank you so much for your time. I want to end
yep,
on, I guess, the future. What does the future look like for? I guess I could ask mental health in general. I don't know if I want to know the answer to that, but even ADHD, autism, neurodivergence. I hope it's looking prettier than what
yeah.
it currently is. I think we've come a long way, but what's
Um,
your vision
I
for
guess
the future?
thinking about that, because we talked about it a little bit before we started, I probably will answer both of those. I'll try and keep it succinct, even though it's not my strength. I I think for ADHD and
Mm.
autism or neurodivergence, those terms get thrown around quite a lot. Neurodivergence, neurodiversity. Um, what I predict, I guess, or what I think will happen is that we will shift away from quite a pathologizing kind of understanding of those two things, and we'll start to sort of see them as different brain styles. I guess my wish would be that kind of I say that it will take lots of work. I don't just mean we just need to abandon everything today and do that. It couldn't possibly work. It would take. I think that's an evolution that would need to happen, but it would mean that we can support people to be the best that they can. One of the most rewarding things for me is I
Yeah,
work in a team and I've got friends and colleagues who understand that I have ADHD and kind of knowing that. And I've got my own strategies, but even them understanding how my brain works has been phenomenal. So I say that that's a privilege. Not everyone can be in
mm, yeah,
that environment, but I think that's what I think. Probably down the track what we might see. I could be wrong. I don't know. I just think that the way that the sort of society is moving is we're trying to sort of um, yeah destigmatize and depathologize. And I think broadly, what does
yeah,
the future of mental
mm,
health look like? I think the future of health at this point, AI is huge at the moment. It's really kind of emerging as I know
mm,
people. There's usually two reactions to that when I say that. People go, ugh, or are very interested. I think, again, with the right approach, and if we do all the right things, I think AI will be revolutionary. There's something I heard the other day. They're trialing this idea of an AI um, kind of like very similar to things like Headspace and the I can't remember the app that I'm thinking of now, Calm, or those kind of apps where you can, yeah, those so there's free apps.
Yeah,
So
yeah,
they're trialing,
yeah.
I think,
No,
this idea of having for what we call high prevalence conditions. So high prevalence being that we've got lots of it. So depression, anxiety, things like that. For people who are you kind of low intensity or low risk of those, having access to an AI counselor, and so people who can't afford, so people could kind of look at it and go, well, that's not, that's very dangerous. But I sort of say, well, if it was the difference between not having any support at all and having this AI that can provide, I guess very basic kind of interpersonal or even sort of CBT strategies, but also building into that the AI to go, something like, oh, based on the way we're talking, I think that, this, I think that there's a lot of work, but I think that's going to be revolutionary because we have so many people who cannot access. Our free
yeah,
services are understaffed and underfunded and overwhelmed, and the services
yeah.
that are pay to access, people can't access them. So I think having something like that or very
No,
similar things is going to revolutionize healthcare.
yeah, absolutely. Yeah. Yeah, as you say, a lot of people go, AI, but in fact, there's a significant,
Mm,
and I think AI is a very general term. I think, we've got robotics doing our operations, for goodness sake. Like, I reckon
yeah.
we can start looking into
Mm,
apps and access for mental health. Yeah, absolutely. This has been fantastic. Thank you so much. I will
sure.
catch up with you and get those resources links, and I'll put them up, or I'll
Great.
confirm them, and we can have them in the show notes for this. Um,
Thanks, Beck.
yeah, thank you so much, Daniel. It's been a wonderful session. I know all of the listeners will get
Thank
something
you.
out of this
Appreciate you
little
having me.
gold
Thank you.
nuggets today. So, yeah, thanks for your time.